Thank you for taking the time to watch the Bella Prenatal Education video. The goals of this video are to provide you with information to use as you decide about your feeding choice for your baby, and information about what to expect when you have your baby at a hospital that follows the 10 steps to successful breastfeeding. Breastfeeding has many benefits for the baby. Breastfed babies have less risk of ear infections, sudden infant death syndrome or SIDS, diabetes, and some forms of cancer. Breastfeeding also has benefits for the mother, including a lower risk of breast cancer, ovarian cancer, heart disease, and type 2 diabetes. This is a picture of 1 drop of breast milk on the right compared to 1 drop of infant formula on the left. As you can see, they are not the same. Breast milk contains living cells, the dark circles, fat globules, the white circles, and special sugars that make it simply amazing. Skin-to-skin contact right after birth is a great way for your baby to get used to this new world. When you give birth, your baby will be placed on your bare chest right away and will not be disturbed for 1 hour. This is called skin-to-skin contact. Skin-to-skin contact has many benefits, including bonding, helping breastfeeding, and keeping your baby warm and calm. Skin-to-skin contact in the first hour of life is important for all babies. For babies whose mothers want to breastfeed and for babies whose mothers want to formula feed. Safety first. Tips for safe skin-to-skin contact include the mother being in an upright position and the baby being held so the face can be seen, the nose and mouth are not covered, the head is turned to one side, and the head is in what is called the sniffing position with the chin up. Get ready for rooming in. Rooming in means your baby stays in your room with you. Examinations, vital signs, and tests will be done for your baby in your room if at all possible. This promotes bonding and allows you to learn your baby's feeding cues. When thinking about how often to feed your baby, don't watch the clock. Watch your baby for feeding cues. Aim for 8 or more feedings in 24 hours. Your baby uses feeding cues to say, "I'm hungry." Feeding cues include sticking the tongue out or smacking the lips, sucking on the hands, and when your baby is moving around. Remember, 8 or more in 24. Proper positioning and latch are important when learning how to breastfeed. Making sure your baby is latched on well will mean you will make more milk and also will prevent you from developing sore nipples. This is an example of a baby who is latched on well. Notice that the baby has a good amount of the whole areola, not just nipple, in his mouth. His lips are wide open, and he is relaxed in a tummy-to-tummy hold with mom. When you are in the hospital, ask for help in learning about the latch. Ask for help again and again. When you go home, go to a support group in your area. If something doesn't seem right, get it checked out. Remember that you need to move the milk to make the milk. Frequently feeding or pumping helps to do that. Lots of moms ask, how long should I breastfeed my baby? Doctors from the American Academy of Pediatrics say breastfeed your baby for about 6 months, then add solid foods and keep on breastfeeding until your baby reaches 1 year of life, or longer if you wish. Thanks a lot for watching this video on prenatal education. This video was written and produced by Dr. Barbara L. Phillip, Professor of Pediatrics at Boston University School of Medicine and pediatrician at Boston Medical Center. She is Nana to Anthony, and the author of The Breastfeeding Blueprint, How to Get Started and Keep It Flowing for a Year, which is available from Amazon in the book department. This video is for educational use only and does not replace medical care. For questions about your baby's health or feeding, please consult your doctor.